Cancer Guidance by Type, Part 9. Dr. Dilip Gadgil, Pune. Yesterday, we were talking about why the disease seemed to be increasing despite Ayurvedic medicines and treatment. The common consensus in such cases is that the treatment is ineffective and hence, people start looking for alternative solutions or doctors. But this isn't the right way to go about it. The important things to look at are: how are the markers? What are they indicating? What are the symptoms? Have they reduced to some extent? How is the digestive system functioning? How is the patient's appetite? How is the pain? Has it reduced or subsided? If things have improved, it means that the treatment is working. The ability to walk, work, and go about your normal routine points towards an improvement in the lifestyle. Who has prepared a questionnaire to help you gauge your quality of life? It can be used to assess the improvements in cancer patients. However, right now, scans and markers are used to gauge recovery success. If these numbers and reports are problematic, people think something is wrong with the treatment. The problem here is that this is a vicious circle. People keep going back to chemotherapy, which affects the immune system, which helps the disease to strike again, and the whole cycle keeps repeating itself. I know examples of people who have undergone chemotherapy 20, 30, and even 50 times. In one case, I was told by the patient that the doctor is insisting on chemotherapy since he believes that is the only solution. Since the doctors themselves cannot think about other potential solutions or treatment options, this rigid outlook eventually causes distress to the patient, leaving them stuck in this cycle. Eventually, the individual's immunity gives up and the disease becomes so unmanageable that they die. Most people survive for a maximum of 5 years. Very few manage to live on after that, and even if they do, their quality of life is questionable. In these 5 years, if cancer doesn't relapse, chances are that it will never happen again. However, there are exceptions to this, too. And hence, the real solution lies in turning towards a natural lifestyle, adopting healthy eating practices, and living an active lifestyle. Unfortunately, nobody is willing to give this a thought today. People believe that undergoing chemotherapy or radiation means defeating cancer. I have always maintained that lifestyle, diet, and exercise are the keys to fighting the disease. However, this wrong concept of recovering through chemotherapy and radiation is prevalent in society. Ideally, these things should be used as a supplementary treatment rather than being the main line of treatment. The sooner people become aware of this, the better it will be for society, and I am concentrating my efforts in that direction.